Hey everyone, it's Maya McNulty. I'm the founder of COVID Wellness Clinic, a long COVID program for long haulers who are suffering from the impacts of long COVID. I borrowed this graphic here from dysautonomiainternational.org, and you can go to them and see this. This is actually an older document, but it's still valid because long COVID, as we know, there's still a lot of research and a lot of science happening that haven't quite addressed these issues of 12 organ systems that are failing or impacted by long COVID. But I wanted to bring to you this information so that if you are struggling with long COVID and you're not quite sure if it's an autoimmune, a chronic, dysautonomia, and exactly what does that mean, right? So we know that the heart has been impacted, heart palpitations, tachycardia, the brain, most of us talk about it being fatigue, cognitive dysfunction, migraines, vertigo. I know I struggled with a lot of this. In fact, I went to vestibular therapy for the vertigo and the ringing in the ears, the tinnitus. My mouth, my front teeth here, they're fixed now, but I don't have any makeup on or lip gloss or anything, so I wanted you to see me in a raw environment here. That I also suffered from tooth decay, but now it's fixed because obviously you can't grow enamel. And so long COVID does affect the mouth. It causes dryness, especially if you're on prescriptions. Many prescriptions lead to having that dry mouth effect. Difficulty swallowing. Being on a ventilator for 6 weeks and trached for 6 weeks, I actually had to go on a feeding tube. And so I was first fed through my nose, and then later I was fed through my stomach and a feeding tube. And sometimes what happens, because I had lost my voice for 10 months, I experienced bilateral voparesis in my neck and here, my larynx, my vocals, the bilateral voparesis. All right. So I had to go to an ENT, and the ENT discovered that indeed it was closing and I needed surgery. And I ended up seeing a voice pathologist because I lost my voice for 10 months. I actually sounded like Minnie Mouse. And thank goodness I'm able to have my voice back. The dryness and itchiness in the eyes, and also the blurriness and the grayness, the gray vision. Now, I know what you're thinking, because most of you, it took me 17 months to drive again after I was in a coma. And most of you are afraid or even embarrassed to talk about some of these symptoms because you mourn your former life. You mourn who you were before COVID and long COVID. And so this graph really shows you some of the things that you can be struggling with and give you some knowledge that it's not in your head. Take it out of your head and put it in front of doctors and say, listen, I'm truly suffering. And you can even bring this video to have proof of something. I'm totally serious, because there's a lot of doctors that don't understand long COVID and or believe that it is actually a 12 system organ impact. Drying the skin. You'll see in my face here that my skin is super dry unless I start putting Vaseline. Vaseline I've been using because my when I had my surgery on my neck, my plastic surgeon said to use Vaseline. And so that's been helping to reduce the itchiness and the rash and the dry skin. I'm on heart medication now. I've never had to be on that before. And so the heart medication is for the heart palpitations, which you can see that's part of the dysautonomia. Blood vessels. There's a thing called micro blood clotting. And I remember 9 months ago, a year and a half, it's been some time because I'm 3 years post-COVID. And I had to go to the ER, and I was experiencing black and blues all over my body. And the D-dimer was not the problem. And I didn't have blood clots because those are painful. And what happened was they were micro blood clotting. And I was gaslit in the ER, where the doctor said to me, you're never going to heal. Well, guess what, buddy? I've come a long way. And so I want you to have these resources and tools so that you're not alone. And when you're sharing your story, you have a document, a source, a resource. There's bladder problems, GI issues, the pain, the back pain in that area, the sensitivity, and then the stomach. So you might feel nausea or vomiting or pain or bloating. And so, I mean, it's more than taking Imodium to help you. You might need to go to your doctor or have a stool test. I know I've had to have that done, where your large intestines sometimes become constipated with diarrhea or with pain, and you might be dehydrated. Dehydration is something that has been known for long haulers and long COVID patients and people that are suffering with long COVID that don't even know it. That dehydration is a major factor. And when your stomach and your intestines and your muscles and your bladder and your cells aren't getting that nutrient, that water, that oxygen to oxygenate, there you go, that you're suffering, and you're suffering slowly. And then, of course, you know, the gallbladder. The gallbladder is a real true indication of inflammation and pain. And so if you're experiencing any of that, go see a doctor. Go see your doctor. Your gallbladder is like a garage door. It opens and closes, right? So it lets things in that you need to bring in, those florals, if you will, like your mouth flora, your stomach flora. You want to keep those gut floras healthy. And your gallbladder helps you to do that. So it's like a garage door. It opens and closes and lets in the thing that you need to stay healthy and clean and nutrient bound. So if you want more information, you want to connect with me, learn more about what is going on with your body and your organ systems and things of that nature, I'm happy to connect with you. My name is Maya McNulty. The link will be up there or below, and you can connect with me at covidwellnessclinic.com, where we have an online care program for long haulers and long COVID patients like you and me. And I myself have created the program because I was suffering with long COVID and not finding the help that I needed, or a long COVID clinic to help assist me in my recovery journey. So I took it upon myself and became resourceful. And so this is a resource which has got PDFs and exercise at your pace. It's pacing. And you can use this program as a guide and a gauge to help you with support and recovery guidance. The link is either above or below, or you can even send me a message and I'd be happy to connect with you and walk you through the steps. Now, chronic disease is real. Long COVID is real. Dysautonomia is real. Autoimmune disease is real. Heart palpitations you're experiencing, none of this is in your head. It is actually happening in real time to long haulers, and they don't know where to go. I don't want that to be your faith. Go to the link in my bio and connect with me. I'm happy to help and walk you through our program. It's set up in cognitive, pulmonary, and physical strength. So you go at your pace. There's videos, PDFs. There's even a gamification to help challenge you to get out of your bed, to get out of your own way, to help you do that one thing. Because just because you can doesn't mean you should, is what my physical therapist used to say. But what it does is helps to inspire and motivate you, gives you actual step by step to help you get going again, to journal, to keep track of even just taking a shower. I know that how that was hard for me in the beginning. And we also talk about the spoon theory, and the spoon theory is it's the expenditure of your energy. So if you only have 10 spoons a day, and you can use this concept as well, use the 10 spoon theory. And what it does is each spoon, so me doing this video is one of my spoons, me getting out of bed and making my bed is one spoon. So I've already used 2 spoons, having breakfast, making breakfast, taking a shower. So as you can see, I'm starting to eliminate spoons. Now you don't get to bankroll the spoons for the next day. You have to keep using your spoons, all 10 of them in one day, and then start over fresh the next day. And you'll see a guideline, you'll see a baseline of yourself being able to heal and recover safely from the comfort of your own home using your cell phone or your computer. I hope this helps someone today to navigate and understand what's going on inside their bodies. There's more videos. You can, like I said, go to the link in my bio and follow me. And I post a video quite often on things that are important. And this graph is from the dysautonomiainternational.org, so you can see that right there, and and you can take advantage of using their website to help also navigate the international Dysautonomia International. I hope this helps someone today. I'm Maya McNulty. I look forward to seeing you on the inside. Thanks for being here, and thanks for being part of our COVID wellness community. I'll talk to you soon.